5 Worst Pandemic in the History of Humankind. Number 5. The Black Death. Estimated death toll, between 75 and 200 million people. Also known as the bubonic plague, was a devastating pandemic that swept through Europe, Asia, and Africa in the mid-14th century. The disease is caused by the bacterium Yersinia pestis, which is primarily spread by fleas that infest rats. The bubonic form of the disease causes fever, chills, and painful swelling of the lymph nodes, while the more virulent pneumonic and septicemic forms of the disease can cause rapid onset of symptoms and lead to death within days. Despite its devastating impact, the Black Death did have some positive effects in the long term, including improvements in public health and hygiene, advances in medicine and science, and the beginnings of the Renaissance in Europe. Number 4. HIV/AIDS. Estimated death toll, 36 million people. It is a pandemic caused by the human immunodeficiency virus, HIV, which attacks and weakens the body's immune system, leaving people vulnerable to other infections and diseases. The disease is primarily transmitted through unprotected sexual contact, sharing of needles, and from mother to child during childbirth, breastfeeding, or pregnancy. In recent years, advances in medical treatments such as antiretroviral therapy have improved the prognosis for people living with HIV and AIDS. Efforts to prevent new infections through education, condom use, and other measures have been successful in reducing the spread of the disease. Number 3. Spanish flu. Estimated death toll, between 50 to 100 million people. It was a deadly outbreak of the H1N1 influenza virus that occurred between 1918 and 1920. The pandemic is estimated to have infected around 500 million people worldwide, making it one of the deadliest pandemics in human history. Symptoms included fever, cough, sore throat, and fatigue, and in severe cases, patients could develop pneumonia and other life-threatening complications. The pandemic was particularly devastating because it occurred during the final stages of World War I, and the movement of troops and civilians likely contributed to the rapid spread of the disease. The pandemic also occurred during a time of limited medical knowledge and resources, and there were no effective treatments or vaccines available to combat the virus. Number 2. Antonine Plague. Estimated death toll, 5 million people. It was a pandemic that occurred in the Roman Empire during the reign of Emperor Marcus Aurelius in the 2nd century CE. The pandemic is believed to have been caused by smallpox or measles, although the exact cause is uncertain. The Antonine Plague is estimated to have lasted for around 15 years, from 165 CE to 180 CE, and it is believed to have spread along trade routes and military campaigns throughout the Roman Empire. The pandemic is also believed to have contributed to the spread of Christianity in the empire, as Christians were often seen as providing care and support to the sick and dying. Number 1. Smallpox. Estimated death toll, 300 to 500 million people. Smallpox is a highly contagious and often deadly disease caused by the variola virus. The smallpox pandemic is believed to have originated in ancient Egypt or India and spread throughout the world over several centuries. The disease is spread through respiratory droplets and direct contact with infected skin or clothing, and it typically causes fever, rash, and fluid-filled blisters that can leave permanent scars or blindness. Smallpox is estimated to have killed between 300 million and 500 million people during the 20th century alone. The smallpox pandemic had a significant impact on human history, particularly in the Americas. It is estimated that smallpox was responsible for the deaths of up to 90% of the indigenous population in some regions. The last known natural case of smallpox occurred in Somalia in 1977. And the disease was officially declared eradicated in 1980. The successful eradication of smallpox serves as a testament to the power of public health interventions and the importance of international cooperation in responding to global health crises.